Okay, Dr. Iram, your patient is Mr. Bilal Khan. He is a 32 years old gentleman come to discuss with his problem. Take focus, history, and examination if required. Okay, like say it's a gray and manage the patient. Okay, doctor, give me 1 minute, doctor. I have to set the timer for you.
Okay.
Okay, okay, doctor, give me 1 minute. I have to. Okay, doctor, start please.
Okay. Hello, Mr. Imran. I'm Dr. Ram. How can I help you today?
Doctor, for the last few weeks, my headache really hurting me every day, doctor.
Tell me more about that.
Doctor, it's been 3 weeks now. I've been suffering from this problem. I'm getting keep on getting this headache, just like say someone put some pressure on my brain, or kind of feeling like something in my forehead and sometimes in back of my head.
Okay. It is started suddenly or gradually?
Doctor, I don't remember actually what happened to me, but I feel that it was just, gradually started.
It is front or back, whole
Yes,
heads.
both head, doctor, both side.
Okay. I give you a scale. One is mild, 10 is severe. How much it is?
Okay, it's 4 to 6, but still I can tolerate, but keep on getting, so it is making me worry, doctor.
Okay. Which make is better?
Doctor, when I'm taking this tablet, when I'm resting, when I'm massaging my head, it make me a bit comfortable, doctor.
Tell me the name, which tablet?
Paracetamol, doctor.
Okay. Uh, does his pain goes anywhere else?
Uh, no, doctor.
Okay. Okay, Mr. Ahmed, do you have any blurring of vision with that?
No, doctor.
You feel light sensitivity?
No, doctor.
Okay. And do you have any fever?
No, doctor.
If you bend forward, you feel better?
No, no such thing, doctor.
Okay. Do you feel any weird sensation on your head and limbs?
No, doctor.
Okay. Any weakness in arm?
No, doctor.
Okay. And do you have any weight loss?
No, doctor.
Okay. And any nausea?
No, doctor.
Any vomiting?
No, doctor.
Okay. Do you have any long standing illness?
No, doctor.
Okay. Do you have any similar problem in your family, just like migraine?
No, doctor.
headache,
No, doctor.
any watering of eye, Mr. Bilal?
No, no, doctor.
Okay. What do you do for living?
Doctor, I'm a IT specialist.
Okay. And how much your screen time?
A lot, doctor. Don't talk about screen time. It's almost sleeping, eating, and everything is screen now.
Okay. And who live with you?
Doctor, I'm living alone.
Okay. And do you smoke? I would like to few personal question. It's okay with you?
Sure, doctor, go ahead.
Do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
Okay. And what do you drive?
A lot, doctor.
Okay. And what type of diet are you taking?
Doctor, I'm taking mostly outside food, junk food, because no time to cook, doctor.
Okay. Do you drink a lot of coffee and tea?
Yes, doctor, I wanted to keep myself awake, so that's why I'm taking a lot of coffee and tea.
Okay. And do you have any idea what is running on?
Well, doctor, I think it's some sort of stress from the work. Maybe sometime I'm taking maybe something serious like brain tumor.
Okay. And do you have any specific worries?
I'm scared that it might be something in my brain.
Okay. Does it affect your life? Did you take a leave from the work for this headache?
Uh, no, doctor, I can't take leave from the work because I'm working on a really big project. Okay, so if I'm taking leave, it will be problem. But I am unable to focus on that. That is another story, doctor.
Okay. And Mr. Ahmed, Mr. Bilal, what do you expect for me today consultation?
Well, doctor, I just want some reassurance, advice, and maybe if you think that there is a need of scan.
Okay. And let's sum up, Mr. Bilal. You have an headache, and it is whole headache, and sometimes you feel a pressure on your brain, and you are suspected that you want to do some scan, and you have a stress at work. Anything else
Hmm.
you want to add in?
No, doctor, that's it, doctor.
Mr. Bilal, I would like to examine you. It's okay with you?
So, doctor.
Okay, I would like to do pulse BP, temperature, BMI, and oxygen saturation, and see your eyes, and make a H for eyes. And can you walk for me and do the power and tone and and
Hmm.
reflexes, and see your back of the eye to see any pressure, uh, anything else.
Examination normal.
Okay. Mr. Bilal, I would like to do some lab tests. It's okay with you?
What you want to do, doctor?
I would like to do your complete blood counts and urea creatinine electrolytes and
Mm-hmm.
thyroid function test,
Mm-hmm.
and also the intraocular pressure to see.
Normal, all normal.
Okay. Uh, Mr. Blal, from your history and examination, um, it seems to me you have an headache. Sir, क्या है ये टेंशन headache?
Mm-hmm. Okay, go ahead, doctor. No worry, doctor.
Okay,
Continue, continue.
okay. It seems to me you have an tension headache.
Mm-hmm.
As you said that you have a much screen times, and you have a lot of stress on your life. Uh,
Mm-hmm.
so I would like to advise you few general things and few and medication. Shall we discuss the management plan?
Sure, doctor. Please go ahead.
Okay, as you take a lot of coffee and tea, would it be possible for you to decrease, cut down your coffee and alcohol, and
Yes,
do
doctor, I can
regularly?
try.
Okay, and would it be possible to decrease your screen time and take a break for relaxation for 10 to 15 minutes in between when you do the office work?
Mm-hmm.
And
Okay, doctor.
also do the simple exercise, start walk from 10 minutes
Mm-hmm.
and go to the 30-minute 5
Mm-hmm.
day in a week. And also the some breathing technique, which is take a deep breath. And um, I would like to recommend you also the if your pain is not relieved by Panadol, I would like to give you a painkiller which is known as ibuprofen twice daily.
Okay, okay, doctor.
Mr. Bilal, do you have any allergy to the
No,
medication? Any
no, doctor.
Okay.
No, doctor.
You can take a brufen twice daily with the meal, and twice daily with the meal, and try it for 3 to 4 days, and you
Mm.
would be feel better. If it is not better, I would like to advise you some talking therapy and supports group which is
Okay,
available.
time up. Dr. Iram, first of all, you were doing very good. Now also you did the good job. So there is no such thing left, but only the thing you don't shake your confidence. Okay. That's what I was looking at your OSCE now. There is no such thing you haven't done in a previous journey with us actually, because in my record, what I have in my record, I have seen that you started from zero and scratch, and after that, I think third or fourth case you blasted actually. Alhamdulillah, you did a very good throughout. Okay, so I am
Thank
not
you, sir.
seeing anything that you have missed throughout. Okay, you have done with me almost 60 to 665 scenarios with me actually so far. Um, what you are missing all the time, there are three or four things I have noted. One is a BMI. You always ask to me, not asking. Second thing, you are not asking about family history. You already covered this time. And fourth thing, you are doing, extra investigations. Okay. When you do extra
Okay.
investigation, it will not be a good sign. We call it not a good clinical practice. Okay. This is a simple headache. So simple headache means doesn't need to go with a lot of medication and histories. Okay. Just for everyone, and those who are going for February exam or April exam, I'm just going to take one small 5 to 6 minutes one time of you to tell you some simple things about headache. Okay, this is one of the most commonest topic tested in the exam in different ways, huh? So first of all, you have to understand that causes of headaches are the two. One is the primary, second is the tertiary. Primary, there is no association and underlying cause condition as this patient, Mr. Bilal, had. And secondly, it can be because of underlying local or systemic pathology. Maybe some tumor is going on, maybe some other pathology is there. Okay, so it can happen because of that. In primary headache, we are getting only few things. Specifically, we are getting migraine. Okay, in that one, you might think about a moderate to severe intensity attacks. Most oftenly, it will be unilateral. Patient will be telling about throbbing or pulsatile in nature. Okay, this is a typical signs of migraine. You might get it. Okay, some patient they will come if you are keep on digging the history. They will ask you about photophobia as you are asking Dr. Iram about photophobia, phonophobia, nausea and vomiting, and sometimes they can occur with or without aura. Okay, which is a transient focal neurological symptoms proceed with accompanies with a headache. Okay, but now second we call it in primary headaches, one of the most commonest tested in exam. or mostly comes in exam as per the GP level is a tension type headache. Okay, which yes, just now we had that one. But in that one, patient will be mild to moderate intensity headache, typically bilateral, pressing or tightening. Patient will be telling you typical story. Doctor, I feel that band is there over my head. Okay, doctor, I feel that someone is holding my head. Okay, so this kind of feeling you will be getting. Okay, there can be photophobia and phonophobia are there, but not both. Okay, there would not be any other associated symptoms. Okay, there will be no vomiting, there will be no fever, there will be no other things. Okay, but it will be continuous. In as like migraine will come and go, but this fellow will be staying with the person who is having. It will be continuous. Okay, then we call it trigeminal autonomic cephalgias. Okay, which we call it cluster headache. Okay, which can cause severe episodes of unilateral pain associated with lacrimation. As you, Dr. Iram, you were talking about, as you asked about eye symptom, rhinorrhea and facial sweating will be there. Okay. Now, typical mostly comes in exam. When you go in exam hall, you see that outside it is written Mr. Adam, age 52 years old, blood pressure 160 by 107, BMI 39. Here you can suspect some secondary thing is going on, either maybe the headache, maybe subarachnoid hemorrhage, maybe some other stroke findings are there, maybe some other pathology. Okay. So here you can think about traumatic, vascular, or infective. If like say infective will come, always infective will come. There will be written temperature. Okay, there will be written temperature, not a blood pressure. Okay, and if like say simple headache is there, there will be written just so focus. No, there will be written no examination required means no examination. But if there is not written any no any examination about examination, it means it's a gray. Okay, so now you see traumatic headache mostly come with a musculoskeletal, including neck, occasionally head injury. Okay, it is not coming in the exam mostly. Vascular, yes, intracranial hemorrhage, giant cell arteritis, stroke. Okay, infective meningitis always come with the patient will come with a fever, neck stiffness, and in that one you can talk about encephalitis or rhinosinusitis. This also can come with with a fever and headache, but rhinosinusitis, doctor, patient will be having the longer history as compared to meningitis, and patient might not come with a fever. Okay, so here the patient will be having runny nose, nostrils, or patient having sinusitis history. Okay, or patient having long history of flu, whatever, so on. Okay, now cranial, where we talk about neuropathies are there, as I was mentioning that trigeminal neuralgia, post-herpetic neuralgia, and optic neuritis. Here in the headache, again, if patient having unilateral problem, then you have to ask about any rash or recent viral illness. Okay, patient might say, doctor, I had a shingles. Okay, you can think about something, some specific lesion. So you have to ask about any scars. Okay, sometime medication over usage. Patient is a migraine patient. Patient is saying, doctor, I'm taking a lot of medicine, but my headache is like say literally not leaving me alone. Okay, or substance misusage. That patient will be young patient. Drug side effect. Patient will be elderly. Started new medication. Caffeine withdrawal. If patient is taking lot of caffeine, but now he's going to switch off. And acute angle closure glaucoma, where patient will come with the eye symptoms, okay, and hypertension with uncontrolled hypertension. Okay, so for further information, for further, we can talk about when you're opening the consultation. Yeah, you're asking about the consultation, then you have to ask about simple thing. Okay, presenting complaint always come with patient, doctor. I'm having this headache. Now, what is headache, doctor? From here, then you can tell me more about it. Okay, once you say that, tell me more about that means like say this is opening question. Here you should not ask closed question. Okay, okay. Once you're asking the closed question, you will get stuck because you will waste time. Here, in once you tell me more about it, patient will talk about his 4 to 5 questions, whatever you're going to ask in one sentence or two sentences. Okay, then. Um, History taking, always remember, doctor, open and close questions. Open questions are always effective at the start of the consultation because here you are going to allow the patient to tell you what has happened in his own word, okay, or her own words, okay. Closed question will allow you to explore the symptoms mentioned by the patient, okay. Now, further, now once patient's giving his his things, then you can ask about closed questions, okay. Presenting complaint, Socrates always mention ask about where is the pain, okay, how when it started, suddenly or gradually, then ask about character, radiation, associated symptoms and time course, okay. Okay, now again exacerbating relieving factors also patient say, doctor, I mean I'm looking at the light, I get triggered, okay. But the patient say, I don't know what's going on with me, so we have to rule out something different. Okay, then severity. This is a simple thing. But key symptoms for the red flags. Either you can ask 3 or 4 symptoms, but no need to ask for longer one. Okay, patient is a young patient. We always ask about vomiting, visual disturbances, and neck stiffness with fever and dizziness. Or okay, these are the 4 5 symptoms you can ask for the young patient with a headache. But if elderly patient come, doctor, that is the important thing again. Vomiting, visual disturbance, dizziness, rash, weight loss, and this one. But patient mother comes to you as a proxy case, doctor, my child is getting headache on and off. So I have to ask about one extra thing which we call seizure. Okay. Or how a child is doing in the class. Whether a child is complaining that he cannot look at the blackboard or whatever so on. Okay, then neurological deficits are there. And if like say some sort of things are there where a patient might be thinking about he might be having tumors, so you have to address patient ideas and concerns or whatever so on. Signposting is always important over here. Okay, so you can start like this, doctor. Whatever we have discussed so far, okay. Whatever, and now we are going to plan. What is the next plan where we are going to discuss? So signposting example, you can say, um, okay, Mr. Bilal. So we have talked about your symptoms, your concerns, and whatever or what you are hoping we can achieve today. We achieve today, whatever so on. Or you can talk about patient's plan. What you're going to cover next. Mr. Bilal, next I would like to quickly screen for any other symptoms, and we will talk about more about your symptoms and your past history. Okay, so this is signposting. Signposting always consider for position holders exams. Okay, so position holders always ask about signposting. Signposting is very rarely been asked by any candidate. Majority of our including me also, we miss that signposting. Okay, so some examples where you have to screen for in that for systemic. Okay, it's like say fever, unintentional weight loss. Patient come with dyspnea and chronic cough. Okay. Cardiovascular, you can talk about palpitation and chest pain, if including the headache, and gastrointestinal with nausea, vomiting. Patient might have dysphagia, abdominal pain, change in bowel habit. And genitourinary, doctor, very rarely you will be getting this kind of case, but patient will come with oliguria. Okay. Now, musculoskeletal always come with the neck pain, one of the most commonest presenting complaint, and rashes, second most. Okay. Psychological, mostly patient will be having stress, anxiety, depression, or substance misuse or medication overusage. Past medical history, you guys are very well trained that what you're going to ask. Ask about allergies. Sometimes it might because of the allergy. Drug history will tell you about misuse, overusage, or some sort of misunderstanding, and patient is using some medication which is not that one. Okay. Now, in medication overuse headache. This is again third or fourth most commonest scenario. Mostly we might get in exam. It's not my guest paper, doctor, but in case of someone ask someone get this kind of scenario here, it will develop as a consequences of regularly more than 3 month use of any one or more drugs that are being used for acute problem. Okay. uh, Actually, it will resolve after we are going to stop the medication. Okay. So mostly patient might be taking opiates. Okay. Any kind of opiates, maybe more than ten per days per month. If patient is taking triptan more than 10 days per month, If patient is taking NSAIDs more than 15 days per month and paracetamol more than 15 days per month, patient is taking, we call it overusage. So here you have to ask, how often are you using the medication? Doctor, every day I'm getting headache, every day I'm taking this medicine. So it means this is overusage, doctor. Okay. Then psychosocial history, as you know, that stress, alcohol usage, caffeine, over caffeination, yeah, and other things are there. So recreational drugs are there, and occupational drugs are there. Or occupation, maybe patient is working in the environment where patient is exposed to high lights. Okay, patient is exposed to some sort of sound. Okay, patient is exposed to some sort of smell. Anything. Closing consultation as per your thing that you can guys go and go ahead. Okay. So this is doctor about headache, simple way. But Dr. Iram, don't be in a way. It will be, it will not give you some sort of, good sign.
सर सारी आपकी मेहनत है.
No, 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 doctor. It's not my. This is based on you guys, doctor. It's not my. Just we are the only. What you say in Urdu, dhakka dena kind of. So we are just pushing you guys only. Okay. So Doctor Hoor is there, no? Doctor Hoor, are you ready for this case?
Doctor, can I do the after that, please?
Okay, then Doctor who is there for next exam? Doctor who? Doctor Nadia.
Yes, doctor. Dr. Imran, how are
Here,
you? Assalamu
fine,
alaikum.
fine, alhamdulillah. Walaikum salam. Doctor Nadia, you are the next doctor, okay? After that, I will take Prabha Hoor.
Okay, no
Okay?
problem. No problem.
Okay. Okay, let me get the case for you. Okay, doctor, your case is mother of Miss, sorry, mother of Master Adam. He is a 10 months old child. Come to discuss her child problem is due to take for history and manage the patient. Examination is not required. Okay, doctor, start.
Okay. Mother's name, doctor. Hello, I'm Dr. Nadia.
Doctor, Doctor,
What
mother's
is
name
mother?
is the agenda that, no, Doctor, mother name is the agenda to discuss. Okay,
Okay.
you have to get a mother name from yourself.
All right.
Okay.
Okay.
Yeah, sure. Thank
Uh,
you.
okay. Hello. Good morning. I'm Dr. Nadia. May I know your name?
Doctor, I'm Mrs. Lena.
Lena. Lena, how can I help you today?
Doctor, I'm just worried about my child. The nurse said that Adam is not putting enough weight. I'm really worried. Maybe I'm thinking I'm doing something wrong with him.
Can you tell me more, Lena?
And doctor, my child Adam, he's my first child. He's 10 months old. Um, he's doing very well. Well, at the birth he was doing good, and everything he's doing good. But suddenly, at the age of 8 to 10 months, I mean, nurse noted that my baby Adam, he's not. He dropped his growth chart figures. So, which is we have a bit concerned for me. Can you tell me what's going on with my child?
Sure, I'll get back to you about this, but I would like to ask you certain questions, if that's okay, Lena.
Sure, doctor.
Where is your, first of all, I want to ask, where is Adam?
Dr. Adam is sleeping with his grandmother.
Grandmother, why didn't you bring him today with you?
Doctor, I thought maybe first I will go because nowadays the flu season is going on. I don't want to expose my child with flu season because of flu.
Okay. Lena, I would like next time, please bring Adam with you. Okay. So I
Sure,
can
doc.
see
Sure,
him.
doc.
All right.
Sure, doctor.
Okay.
Hmm.
So can you tell me about the birth of Adam? Was everything fine when he was born? You said that everything was fine. So can you tell me in detail that was he born with C-section or was it a normal delivery?
Doctor, he was normal delivery. He was born. His weight was 3.2 kilo,
Mm-hmm.
and everything is fine, doctor. Even though
And
what
mhm.
I am more concerned about his vaccination and everything. So everything is up to date, doctor.
Okay, the immunization's up to date. And can you tell me that what type of diet he's taking?
Well, doctor, shall I start from beginning? Because he is exclusively breastfeed till 4 months, and after 4 to 10 months, I started reducing his feeding because I have to go back to work. Okay, so mostly he is taking formula and plus breastfeed in the evening, and I started solid doctor when he was 6 months. Okay, and based on the nurse, I started from pureed vegetables, fruits, and sometimes cereals. And yeah,
Okay. So he was, and can you tell me that how was his development?
doctor, he was doing very well up till date.
He was smiling at. Mhm. Mm-hmm.
Yes,
Yes,
doctor,
please
he
carry
was
on.
doing very well. Yeah, yeah, doctor, he is doing very well.
Yes, Lena.
Mhm.
Okay, that's good to hear. Okay, can I ask you that is he, how's his urine
Urine
color?
color is
Is he
fine.
passing urine?
Fine, doctor.
Okay. How many nappies does he wet?
Doctor, 4 to 5.
4 to 5. And what about his stool? Is it normal?
Normal, doctor.
Normal. Okay. Did you find, is there any sleeping difficulty with him?
No, doctor.
No sleeping difficulty. And
Yes.
you said that you were breastfeeding him. Now, did you stop the breastfeeding or still you're in that process of stopping it?
No, doctor, I just reduce it actually because I'm working.
Okay. What type of work you do
Doctor, I am a office. I'm working in office as a clerk.
as a clerk? Okay. And now you said that it's been a few like after 10 months, he's 10 months, right? So you're finding that
Yeah.
he's not growing. He's not
Yes,
growing.
doctor.
So like any specific idea that you're thinking of what's happening with your baby?
Maybe my milk dried and now he's not getting enough.
Mm-hmm. I would like to ask something more if that's okay. It will be something, some personal questions would be regarding the family. Anyone in the family having the same situation
No,
in the
doctor.
family? No. Or any genetic conditions running in the family?
No, doctor.
Nothing like that. Or any high sugar level
No, doctor.
or any high blood pressures?
No, doctor.
Even for the baby, I think so. You said he was vaccinated. Was he ever found to have any lab tests done specifically by any doctor or any pediatrician?
Doctor, last time his blood test done at 6 months. Everything was fine, doctor.
Okay, that's good to hear. Okay. And so what is actually worrying you? after this, his
Doctor,
growth. Yeah. Mm-hmm.
doctor, I think is he getting? He's going to be stunned or some having brain damage.
Brain damage. Okay. Mm-hmm. All right. I would like to ask you, because this is your first child, you're living with whom at home? Who's the one who's living with you?
Me and my husband with my his grandmother.
Everything is fine at home,
Yes, doctor.
and at your workplace, everything is good.
Yes, doctor.
All right. Okay, Miss Lena, what we would do is that we might run some tests on him. But the thing is that
Mm-hmm.
before I have to see your baby. Then only I can give you some tests or some management plan.
Sure,
Okay,
doctor.
right? So it's better that you bring him along, and I will check his growth chart myself. Okay,
Mm-hmm.
and we'll run some tests and we'll
Sure,
manage.
doctor. Sure, doctor.
Okay. But before I cannot manage him like this. You need to bring him.
Okay. Okay, doctor.
Okay.
Mm-hmm.
Right.
So what do you expect from doctor?
I will do some tests for him, but you need to bring him over here. I'll do a complete
Mm-hmm.
blood count for him just to check whether he's anemic. We'll do a
Mm-hmm.
growth chart also. You
Mm-hmm.
said you were
Mm-hmm.
doing and your nurses was doing. We'll do a growth chart for him. We'll do a
Mm-hmm.
urine dipstick. We'll check his urine also. And we'll do a Celiac body test for him. You know what is this test? Celiac body? Celiac
No, doctor.
antibody test. Actually, this is that when sometimes children, when they're eating, they are not absorbing certain things and they're not growing that well. So we'll do
Mm-hmm.
that. We'll check
Mm-hmm.
whether he's having any
Okay,
problems with
doctor. Okay,
absorption.
doctor. Okay, doctor.
Okay. Any
Mm.
specific foods is he picky about any food particular, if you can tell me?
Doctor, feeding is really stressful. Sometimes I have to take 45 to 60 minutes per meal.
Feeding is stressful. He's getting breathless during feed.
No, doctor, he don't like. Often
He
turns his
doesn't.
head away and clumps mouth, or sometimes he gets distracted.
Hmm. Well, as I advise, you need to bring him. Okay, so I can see him.
Okay. So what, doctor, when do you think what can be the diagnosis, doctor? Yes, I'm
Well,
scared
right.
about my baby, doctor.
Well, the thing is that you're saying that maybe he's stunting growth or brain damage. No, I don't think so. It's something like that. As long as he's active, as you said. He's sleeping. He's active. Is he active, Lena?
Yeah, he's active, doctor.
So, like right now, I would not worry much, but I need to see him first. And I'll run some tests and then only I can give you a management plan. Before
Okay,
that, I
doctor.
cannot. Okay.
Okay, okay, doctor.
All right. There are a lot of things running in my mind as well. So I cannot diagnose without seeing him.
Okay, doctor. Okay, okay, doctor.
Okay.
Okay, done. Okay, Dr. Nadia, this kind of toxic case in the by the doctor. First of all, for the data gathering, we have to ask about duration and pattern of poor weight gain. Okay, using the growth chart, she mentioned already that he was growing up to the mark after 4 months. He started stopped sorry, reduced the breastfeeding and started on formula, and again she started solid food after 6 months. Okay. Then detailed feeding history, type, volume, frequency, solids introduction, and feeding behaviors. Okay. So you asked very well. Vomiting, diarrhea, stool frequency, respiratory symptoms, recurrent infections. So here you ask only about DAPIs. So you ruled about look like for hydration status and stool frequency. But yes, you forget to ask. Okay. Then developmental milestones like say gross motor or fine motors you are partially. And is she pregnant or not? What is the mother LFP? Okay, that's mandatory to ask. Okay, she was about what you call it 8 weeks pregnant. Now, social factors are there: family support, stress, maternal mood, fitness, finances, housing, whatever so on are there. Even though abuse also, you have to rule it out in this case because patient the child is living with my grandmother. Red flags for organic disease like say recurrent infections are there, chronic diarrhea is there, vomiting, respiratory symptoms or developmental delay. As patient came back from sorry, this patient child mother was referred from the nurse. So here you have to look into that one. Maybe you can say that I'm looking into multifactorial things. Okay. It can be what you call it failure to thrive or faltering growth. Okay. Why I'm saying Mrs. Khan that I'm suspecting there is a caloric insufficiency and insufficient feeding. Okay, small intakes and prolonged stressful feed. One thing, possibly high parental anxiety. You would look like patient is over anxiety because she is pregnant. Okay, second thing, no immediate red flags are there or serious organic disease and or safeguarding issues in this scenario. So you can say that Adam's weight has dropped across his usual line on the growth chart. Okay, this is what we call faltering growth. Okay, it often happen when babies are not getting quite enough calories for their needs. Okay, but often it can be improved with support. Here, you have to reassure the mother. Okay, patient, if like say if you're suspecting any red flag, yes, you should not give any diagnosis. But when you are not having any red flag, doctor, so you have to give the diagnosis. That is mandatory in our and initial impression. This is an important thing. Management plan. You can say that if next time you have to bring your child along with you, then we might be doing that as we clearly told that investigation. That is really that is really good to you mention and practical feeding support. Here you can give small support as a via Mrs. Khan. What you can do is you have to give her regular feed, your child feed, and as per the age appropriate amounts, formula and solids. Okay, encourage 3 meals and 2 to 3 snacks per day. Okay, my mother is giving only one or two with energy dense food like say full fat yogurt, mashed potatoes with oil or butter or lentils, according to the local norms. As like say, and we can talk about it, the Pakistan style. Okay, limit feeding time to reasonable duration, 20 to 30 minutes to reduce the pressure. Mother is feeding 45 to 60 years, doctor. That is we call it pressure, stressful. Okay, and avoid force feeding or turning meals in a time into battles, like say shouting, beating, and hitting kind of stuff. You should avoid. Okay, and then you can say in one of the best way that for next visit. By the meantime, I will be I'm going to write down one letter to health visitor, or she will be visiting your child at home. And she will be looking at your meat patterns or diet pattern. Here you are going to, in unknowing way, you are going to, alert that you are thinking about child abuse also, huh? And monitoring and investigation will be very well told. I am not going to address anymore. And safety netting, you have to do it. Okay. Summary, doctor, you have to summarize. Even though this is a proxy case, but you have to summarize. Okay, thank you, doctor. Then Doctor Who is there, or we will be moving to
Yes,
health.
doctor.
Yes, doctor. Doctor
Okay.
Who, give me 1 minute. I will be taking your case for my side. Okay, doctor, your patient is Mrs. Mariam. She's a 30 years old female. Come to discuss her problem with you. Take focus history, explore her concerns and expectations, and management and investigation. Examination is required. Okay,
Required. Okay.
not required.
Oh, okay.
Okay, start.
Um, Hello, good morning. I'm Dr. Hoor. May I confirm your name and age, please?
Doctor, I'm Mariam, 30 years old.
Okay. Hi, Mariam. What can I help you today?
Doctor, I don't know. May I tell you something that I feel that embarrassed to talk?
Well, Miss Mariam, whatever you will tell me, it will be confidential in both of us. And as a professional, we are dealing some personal matters of some patients. You can trust me. I will try my best to help you.
Thank you, doctor, for safeguarding me. Doctor, we have been trying for the baby for a long time and nothing is happening.
Okay, okay. Could you tell me more about it?
Doctor, I'm 30 years. Okay, my husband is 32. Okay,
Okay. Mhm.
and initially I was taking contraceptive when I was not married. Now it's
Mhm.
been 18 months. We are trying. We are not getting success, doctor.
Okay, okay, Mrs. Mariam. So, is it okay if I ask you a few more questions so that I can help you?
So, doctor.
Okay, so it's been 18 months you people are trying. So,
Yes, doctor.
okay, so when you have your last menstrual period,
Doctor, my last menstrual period was 2 weeks ago.
and is it regular?
Yes, doctor.
Okay, and may I know the frequency of sexual intercourse in a week?
Doc- Doctor, 2 to 3 times per week.
2 to 3 per month. Okay, and okay, may I ask you some questions regarding to your husband?
So, doctor, please.
Okay, during the intercourse, does he have any problem?
No, doctor.
Okay, okay. So, Mrs. Mariam, so you haven't succeeded one time as known, right?
Sorry, doctor.
You didn't succeeded at all during this
No, no,
18 months. Okay,
not at all, doctor.
okay, okay. So, Mrs. Mariam, do you feel cold compared to others?
No, doctor.
Okay, and any headache,
No, doctor.
any blurring of vision,
No, doctor.
any? Do you notice any acne on your face?
No, doctor.
Okay, any unintentional hair growth?
No, doctor.
Okay, okay. Any discharge from your front passage?
No, doctor.
Okay, in between the periods, do you notice any bleeding?
No, doctor.
Any discomfort during the time of intimacy?
No, doctor.
Okay, okay. So, Mrs. Mariam, is it your first marriage?
Yes, doctor.
And what about your husband? Is it his also first marriage?
Yes, doctor.
Okay, and it's been 18 months. Have you did you do any kind of investigation?
No, doctor.
Okay, and what about your husband? Did he do any investigation?
No, doctor.
Okay, okay. So, is your husband is with you today here?
No, doctor. We don't want to see the doctor because he said that fire fault may be from my side, so I have to check myself first.
Okay, so he is thinking that it's fall from your side. Hello?
Yes, doctor.
Yeah, so he think it's the fall from your side.
Yes, doctor.
Okay, okay. And okay, Mrs. Mariam, I just wants to know, do you have any chronic illness like any high blood pressure,
No, doctor.
high blood sugar,
No, doctor.
any other significant illness?
No, doctor.
In your family, anyone has a similar problem of like getting pregnancy problem?
No, doctor.
Okay, and what do you do for living?
Doctor, I'm teacher.
You are teacher. Okay, and whom do you live with at home?
Doctor, me and my husband.
Okay, and because of this not getting pregnancy, how is relationship between you and your husband?
Doctor, fairly enough. Doctor, fairly good.
Okay, good. Okay, and may I know your weight compared to your height? Did you recently checked?
Doctor, my BMI is 29.
Okay, and do you smoke?
No, doctor.
Drink alcohol?
No, doctor.
Any party drug you are using for any other reason?
No, doctor.
Okay, and anything crossing your mind why it's happening with you?
Doctor, maybe I'm having a problem. with my
Okay.
hormones or my eggs?
Well, I will come back to this point later. And I know you are very concerned of your pregnancy. Apart from this, any other particular concern?
Doctor, I'm having social and family pressure, especially in my in-laws, doctor.
Family pressure, yes, I can really understand. It must be very difficult for you. And what exactly you want me to do for you today?
Doctor, is there any hormone tablets that I want to take straight away, or maybe you can suggest some IVF?
IVF. Okay, I will come back to this point later. And how is this thing impacting your relationship or your life? I know you are very stressed.
Doctor, I'm all the time tearful and feeling low and anxious,
Mhm.
and I really
Okay.
it's difficult for me, doctor.
Okay, I'm so sorry to hear about all the things which you are having going through. I will try my
Yes,
best
doctor.
to help you. So let me quick recap. You have come to me because you are trying for pregnancy for last 18 months.
Yes, doctor.
You think it's because of some hormonal problem in your side, and you want me to give you some hormonal tablets or want to refer you for IVF, and it's really you are impacting your daily life. Anything else you want to add?
No, doctor, that's it, doctor.
Okay, okay, Mrs. Mariam. So far, what you have told me, and it looks to me that you are having some condition which is called primary infertility. Do you have any idea what is it?
No, doctor.
So it means that as I have asked you so many questions regarding your health, so I did not find any abnormality, but we need to
Hmm.
confirm it by doing some investigations. Okay, so
Okay, doctor.
sometimes the couple when they get married, even everything is going on smooth. Now sometimes they are not successful of getting pregnancy in the first year or even in the second year as well, but that
Hmm.
doesn't mean that they will not get pregnant. Okay, or that doesn't mean
Hmm.
that
Hmm.
you have any problem in your side. Okay,
Hmm.
so
Hmm.
it's so 90% people can get pregnant in the first year. Some 80 to 85% people also can get pregnancy in the second year as well.
Hmm.
So my suggestion is that right now there is no need for any hormonal tablets or no need for any IVF. You can try
Hmm.
naturally, but also it's important to bring your husband as well so that we can test for both of you. Are you getting me,
Hmm.
Mrs.
Hmm.
Mariam?
Yes, sir, doctor.
Okay. So we cannot say this only from your side. We need to do test for your husband as well. We need to do semen analysis for him and for you
Hmm.
also. We can do some basic blood test with some hormonal test.
Okay, what hormone test, doctor?
Okay, we can go for the so complete blood count, fasting blood sugar, thyroid function test, serum prolactin, FSH, LH, and 21-day progesterone, and urea and
Okay, doc.
electrolytes, and urine test. Are you getting me?
Anything else, doctor?
Um, serum prolactin, um, serum testosterone, and
Anything else,
ultrasound,
doctor?
and ultrasound of your lower tummy.
Anything else, doctor?
I will check with my labs. Then I can get back to you what test
Okay, doctor.
else
Okay,
I need
doctor.
to add. Okay. And in the meantime, please bring your husband as well so that I can also talk to him and I can also tell him that it's not about your fault. There should be no need for us, no need for blame nowadays. I'm sure if I tell him something, he will understand. Okay.
Okay, doctor. Okay,
Okay,
doctor.
and in the meantime, just keep started your folic acid tablets. I will write for you
Hmm.
the folic acid. You will continue
Hmm.
to take it and
Hmm.
keep your self hydrated. Eat some healthy diet like contain more fruits and vegetables, or you can go for daily some regular exercises as your BMI is high. So if
Hmm.
you reduce your weight as well, it will also helps to chance of getting successful pregnancy.
Okay, doctor.
Okay, so I
Hmm.
hope. So I will tell my nurse to collect some bloods for you. So do we will do the investigation, and we would like
Hmm.
to see you again when your investigation will come as well as
Time up.
that. Okay.
Doctor Hoor, mostly I don't say anyone excellent, but I will say excellent. Okay, because I'm very bad in saying excellent with some cases. Because why? Because I like that approach. Whatever you go on through and thoroughly patient-centered, thoroughly, exploring, technique and tactics you used, and thoroughly humble, and you understand the sensitivity of the case and sensitivity of and the nature of that case and scenario where you had a lot of chances to exploit the patient, things, and patient might get some sort of, exploitation and might get offended. Okay, that's what we need it. And doctor, Alhamdulillah, everyone is doing very good. It is my surety because I'll tell you, I have gone through this period, and that was quite tricky period because there was no one to guide me actually. Okay, so I can assure you guys that you guys are doing wonderful, wonderful doing. Okay, only the thing, everyone having their own style to talk, own style to catch up the story and do it. Everyone is doing good. Here, it's not a matter that you did a wrong diagnosis. It's not a matter but the thing, as long as you didn't harm the patient with the wrong medication, wrong treatment, and you referred the patient, you are pass. Okay, so exam is not something. Once you go through the exam, you will remember that what I said, that what I'm saying, you guys. This is a simple exam and simple way. It's not a something that very high-fi thing stuff. Okay, but important again, please trust yourself. There is no such thing, doctor, that what's going to happen. Everyone having their own exam and their own style. Okay, so there's no such thing. Alhamdulillah, you're doing good. But doctor, just add one more thing here. STI screening. Okay, no matter patient is active or not active, STI screening for patient is mandatory, and you have to ask about previous UTIs. The rest,
Oh, yes.
everything was fine.
So, doctor, any kind of infertility patient, we need to rule STI as well.
Yes, doctor.
Okay, okay, yes, yeah, yeah. I forget. I'm not recalling what I missed that time.
That's what I was saying. To what else? Anything else, doctor? The reason this is my style to give you some sort of push that what you was thinking about. Okay, so this is an important thing to ask from the patient that about this is very sensitive question. Okay, so that's it for doctor for April candidates. Now we will be moving towards, sorry, sorry, for February candidate, we will be moving to April candidates now. Dr. Mavish, are you ready for the case?
Yes, sir.
Yes, Dr. Mavish. So we will be taking your case first as a April candidate. Okay, Dr. Mavish, one of your patient, he is a 52 years old, Mr. Nabil. Um, Come to discuss his reports with you, take proper history, and manage the patient. Examination is not required. Okay.
Okay. Hello, Mr. Naveed. I'm Dr. Mahvish, one of the GPs today. How may I help you today?
Hi, doctor. Doctor, I just wanted to discuss my reports with you. I just wanted to know what's wrong with me, doctor.
Okay, so show me your reports.
Doctor, this report showing total cholesterol is 235 high, and LDL is 160 high, HDL is only 28 low, triglyceride is 197 high, fasting sugar is normal, rest of the investigation is normal, blood pressure 144 by 88, repeated multiple times.
Mm-hmm. So, why did you do this? Can you tell me?
Doctor, yes, doctor. I'm having high blood pressure
Mm-hmm.
almost 10 years now. Doctor, I'm taking this tablet amlodipine. This is my routine test I'm doing every year. This time I have found this is gone up, doctor, without doing anything, doctor. I'm not taking any thing extra, but still my cholesterol is going higher and higher, doctor.
Mm-hmm. So, can I ask you further question, Mr. Naveed?
Sure, doctor.
Mm. So, did you have any feeling of chest pain? Did you have ever feel that?
No, doctor.
Okay. Any weakness or numbness in your arms or legs?
No, doctor.
So, have you ever been diagnosed with high blood sugar?
No, doctor.
No. Have you ever have heart attack or angina symptoms?
No, doctor.
No. Have you any visual problems, vision problems?
No, doctor.
Okay. So, Mr. Naveed, do you have any family history of heart disease or high blood pressure, high blood sugar issues?
Doctor, my father had a heart attack when he was 58 years old, doctor.
Mm-hmm. Right. So sorry to hear about that. Is he okay now?
Yes, doctor.
Okay. So, does anyone in your family have raised cholesterol level
No, doctor.
as well? No.
No,
Okay.
doctor.
So what do you do, Mr. Naveed?
Doctor, I'm accountant.
Okay. So, is there any stress at your home or at your work? Is there anything
Doctor,
like?
as usual, because I'm working as an accountant, so my job is like this. I have a lot of stress over there, doctor.
Mm-hmm. Okay. So, do you smoke, Mr. Naveed?
Yes, I do smoke, doctor, but
How
I
much?
stopped
And
smoking
how long?
almost 2 years
Mhm.
ago.
Right.
Nowadays, I'm
That's
not
great
smoking,
news.
doctor.
Okay,
I
that's great
smoked,
news.
doctor,
And
20 years, doctor.
okay, okay, fine. So, do you drink alcohol or any recreational drugs are you taking?
No, doctor.
Right. So, do you know about your weight according to your height, Mr. Naveed?
Doctor, I'm a bit obese
BMI?
actually. Yeah, I'm a bit obese,
Mm-hmm.
doctor. My BMI is 34.
Oh, so and how much do you exercise?
Doctor, I don't go for exercise.
Okay. And what about your diet or routine general
Doctor,
diet?
mostly breakfast I don't take.
Mm-hmm.
Lunch I take fast food and from the canteen. Mostly it contains fried chicken, burgers, and chips. And
Mm-hmm.
dinner I take rice, meat, and sometime vegetable. Doctor, monthly one time, two time. I take the
Mm-hmm.
snacks like the biscuit and sweets in my office.
Mm-hmm. Okay. So have you ever have you any urinary symptoms as well?
No, doctor.
Right. So have you ever feel recent chest infection or sputum, anything like that?
No, doctor.
Okay, right. So, what do you think that you have raised cholesterol levels and raised deranged lipid profile? Do you have it?
Doctor, my maybe because of my food I am eating, but my friend said that high cholesterol can kill suddenly, doctor.
Mm-hmm. Is there anything that is worrying you about your cholesterol levels?
Doctor, I'm just talking about, I'm just anxious about taking this liver damaging statin tablet. What I read on Google that I have to take it because this is a cholesterol tablet I heard, I do believe.
Yeah. Are you taking cholesterol tablets or
No, doctor, but
only
I read on
high
Google,
blood?
I read online, doctor.
Okay. Oh, right, right. So, and what were you hoping we could do to lower your raised cholesterol? Just to start a tablet, cholesterol tablet?
Doctor, I just wanted to know that is there any other way that I should not take this cholesterol tablet?
Right. Okay, I got it. So, Mr. Naveed, you tell me that you did your lipid profile just for screening purpose, and it became high. It came higher. Total cholesterol and triglyceride came higher side, and you have no any symptom of chest pain or palpitation or any other symptom, and you have sedentary lifestyle, like you eat junk food, and your central circumference is also high, like your BMI is 34. Is that all, or you want to add anything else?
No, doctor, that's it, doctor.
Okay, so Mr. Naveed, you are basically hypertensive, and you are suffering from dyslipidemia or deranged lipid profile level. Have you heard about that before?
No, doctor.
So basically, these. I want to tell you that this become because due to bad cholesterol, and just because of your sedentary lifestyle, fat accumulates in our arteries, and that may cause later on may cause heart attack and severe stroke. Okay, so
Mm-hmm.
I would like to tell you that you have to avoid fatty foods from your diet and fatty meals. Can you do for that? Can you do it?
Yes, doctor. I will try my best,
Yeah.
doctor.
I would like to tell you that you have to enhance healthy food, and encourage at least 5 portion of fruit and vegetables. Can you do it?
Mm-hmm. Okay, doctor.
Okay. At least you have to take 2 portion of fish, and four portions of unsalted nuts. Okay, if you can
Okay,
afford it.
doctor. Okay, doctor.
Other than that, for your central obesity, you have to walk or exercise for at least 30 minutes, 5 days a week. Can you able to do it with your
Okay.
job?
Okay, doctor.
Smoking, you are already you are already quitted, so no need to tell about that. And I would like to offer you statins. You have to take it, because that will reduce your all bad cholesterol.
Okay, doctor.
And I would recommend you that you have to take it for 3 months.
Mm-hmm.
Statin along with amlodipine 5 mg that you are taking
Mm-hmm.
already.
Okay, doctor.
Right. And I would like to offer you some investigation as well. Will you able to
Mm-hmm.
do it?
Okay, doctor.
I would like to tell you that you have to do ECG and HbA1c, and CBC and TSH. And you
Okay,
will
doctor.
review after these results. And I will recommend you to do LFTs and lipid profile after 3 months.
Mm-hmm.
Right. If
Okay, doctor.
there is any chest pain and visual disturbances, and any numbness in the limb, you can seek our ER immediately.
Okay, doctor.
Is there anything else you want to ask me?
That's it, doctor.
No question?
No, doctor. Thank you, doctor.
Thank you.
Dr. Mavish, this is, I think, first time I have did a case with you. Your case, your approach is really concise. That I like it. But when you're talking about the summary, you should not talk in summary about everything. Okay, you can say, Mr. Khan, let me summarize. That you came to discuss your report, which is little. You are worried about your cholesterol report, which is high, and you wanted to know, and you are a bit reluctant to take the medication. So shall we discuss the management plan with you? Okay, Mr. Khan, as per your report, I have seen that you are suffering you're having the problem which we call it high cholesterol level, but this patient having a mixed picture. Okay, so we call it mixed hyperlipidemia. Okay, so you have to talk about in a way. And Mr. You know what is this one? It means, like, say, in your cholesterol, out of the five parameters or four parameters, your three parameters on higher range and one is on lower side. So this one we call it mixed hyperlipidemia. Okay, and then you can talk about whatever you have mentioned. That is the important thing. Just for in a nutshell, just two or three parameters I'm going to talk about. Rest everything you guys knows. First of all, Why don't want you to take the patient don't want you to take the medication because of side effects? Okay, so we have to tell that minimum side effect will be there, and there is no such harm, there is no such problem. So only this mild muscle pain or cramps you might get it. Otherwise, there is no side effect. The benefits are more than your side effects. Okay, so now here. You might get the picture of raised LDL or raised triglyceride. Maybe you can get the picture of low HDL, or maybe combination. You might get it in our condition. Okay, in the primary will be genetic versus secondary due to another cause. Okay, so you have to, and in the familial, mostly family history of hypercholesterolemia, autosomal dominant, very high LDL and early CVD chances are there. Okay, familial combined hyperlipidemia and familial hypertriglyceridemia. Okay, now secondary we have to think as a diabetes heart. Okay, so it's kind of, what you call it, mnemonic. D for diabetes mellitus, I for inactivity and obesity metabolic syndrome. Okay, A for alcohol excess, especially in a triglyceride. B for biliary or cholestatic liver disease. E for endocrine, in that one it will come as a hypothyroidism or Cushing's syndrome. T for thiazide, diuretics like say drugs, so beta blockers, non-selective beta blockers, steroids, antiretrovirals, and atypical antipsychotics, and some immunosuppressants also cause this problem. And serious renal disease, patient having nephrotic syndrome or CKD, they might have a secondary hyperlipidemia. Okay, so the thing, it will be more easier to understand what is the cause of that one. So you have to explain. You might be getting the cause of alcohol, Mr. Khan, and it can be the cause of your sedentary lifestyle. It can be the cause of serious renal disease. So as per the scenario, doctor, you can go. But clinical features, doctor, mostly will be asymptomatic. Patient will be asymptomatic. Okay. Red flag sometime can come to you very rarely, where patient having tendon xanthometas, kind of like say, Achilles tendonitis, or extensor tendons, or of the hands, whatever, so on, and then thalasma around the eyes, and corneal arcuous, very young patient you might get it. Okay, strong family history of premature cardiovascular disease like say MI, like say in this case MI, and stroke under 55 and under 65 in the female. Male 55. His father had 58. So we don't call it strong family history of premature. Okay. If like say he said that my mother had this problem when she was 58, yes, this is a premature. Okay, and personal history of premature CVD. Okay, investigation, we have to talk about patient already coming with the report, so you can see and you can discuss about management. You should ask in a simple way, doctor: diet, weight, exercise, smoking, or alcohol, if any. Okay. In OSCE, doctor, you are not going to explain each and everything. You are going to take 1 or 2 points from the diet, 1 point from the weight, and like say, Mr. Khan, you are taking this lot of mostly taking food from outside. So I will suggest you to take home food, which should be containing 50% vegetables, 25% carbs, and 25% should be protein. Are you getting me? Okay, and you can go for 1 or 2 examples and come out. Increase fruit intake and whole grain and legumes. You have to take it, and consider Mediterranean lifestyle pattern. Okay, weight management, as you have in job, you would have a desk job. So here you have to tell the patient you have to go for a walk, exercise for 30 minutes daily per daily, or 150 minutes per week, or 75 minutes vigorous, if like say he is able to do it. If patient don't have knee joint pains. Okay, patient is smoking, doing the smoking, so strongly encourage that patient have to stop the smoking, and limit alcohol if patient is alcoholic. When you're starting the medication now here, you will say that I'll be checking your heart cardiac risk score. Okay, so what you going to do? 10 years CVD risk score. Okay, and After that, you will be saying that your cardiac risk score say that it is higher on side. For that one, we are going to, there are few patterns are that we have to start a medication. So shall we start or shall we discuss on that one? So then you talk about statins. Okay, first line in most of the guidelines. Okay, when patient is having raised LDL and a high cardiovascular CVD risk, and benefits. You can tell that benefit reduces the risk of MI and stroke. Okay, and its common side effect you can say mild LFT derange or rarely myopathy or rhabdomyolysis. In my exam, there was one scenario. Patient was an elderly patient, and she said that I'm getting doctor shoulder pain and chest pain, and my body joints paining. Okay, body pains are there. Okay, so I was thinking about fibromyalgia. When I asked about do you take any medication, she had one paper with her and she given me, and it was written 40 mg start, sorry, if 20 mg started. So I asked when you started, and she was complaining of this pain for 4 weeks, and she started this tablet 6 weeks ago. So it means that is statin induced myopathy. So case can come like this also, doctor. So here we have to go in a 360 approach where we have to talk about side effects, and side effects, because of the side effect also patient will come with myopathies. Okay, here agenda was to stop the medication or refer to the specialist. If patient having high cardiac risk, then we have to refer this patient for the cardiologist. Okay. So the second case can come, doctor, I am taking this cholesterol tablet, but still my medication, my cholesterol is not getting going down. So we have to ask this how long you're taking. If patient is taking more than 6 months and patient second reading also on higher side, less than 40% reduction is not there for the LDL, we have to start ezetimibe. Okay. So to add on one more drug. Okay, and for example, one more scenario can come. Patient, everything is fine, but triglyceride is high. So here we have to go with a strong lifestyle where patient have to reduce the carbohydrates, red meat, alcohol consumption. Or patient, if patient is having the hypothyroidism, if patient is female is a patient is a female and having hypothyroidism. So if patient uncontrolled hypothyroid, so it will be increasing the triglyceride. Okay, so we have to consider along with that one fibrates. Okay, so fenofibrates you can try as per the protocol and guidelines. Okay, and follow up and monitoring, we will be checking that if like say we started the medication every 3 months, we are going to check it. And if like say we started a medication, up now patient came for the refill, he is improving. We will be continuing the medication, but we will be checking his or her cholesterol level after 6 months. Okay, and we will be doing periodic LFT check because statin induced, fatty liver is one of the most commonest cause, and this kind of scenario can come in the exam. Okay, where the agenda will be to stop the medication or minimize or reduce the medication, or patient is a high risk, so we have to refer the patient to the cardiologist. Okay, doctor. So,
Uh, Hello,
yes, doctor. Yes, doctor.
doctor. Can we start statin immediately, or we have to wait for 3 months and put the patient on the lifestyle first?
Doctor, this is based on the readings. Okay, for example, this patient had one family history of cardiovascular, but it is not premature. Okay. Second thing, patient was ex-smoker. Patient is hypertensive. Okay, so we have to see the cardiovascular risk score. Okay, for example, if cardiovascular risk score says that is a low risk, so we can put on diet style lifestyle modification. But if patients is having high risk patient, so we have to start medication.
Okay. So in this case, we have to advise few more investigation like HbA1c and thyroid function test and creatine kinase if in case of like body ache, and then we can decide that
No, doctor, if like
now
say
we
patient
start or
having
not.
body ache, yes, doctor, but if patient don't have body ache, don't go with over ordering of investigations. Okay, it will be again a pitfall for the exam. Okay, so over investigation, unnecessary investigations also is another reason to give unsatisfactory in the exam.
Okay.
Okay, and
Okay, thank you.
moreover, doctor, already patient will be coming with you. Some many times they will be having all the investigation with them.
Okay. One more question, Dr. Imran. In counseling cases, we have to ask ICE in the beginning of the history taking or at the end. after taking all the history.
Doctor, counseling casing, mostly we will be asking eyes in the beginning, okay? Because it will
Like in
make,
this case, the patient brings report. So in this case,
yes, you can say, do you think, have you read this report, Mr. Khan? Okay, what do you think about this report? What is your idea? Okay, so a patient will be giving you idea, doctor, I'm thinking that I have high cholesterol. Okay,
Mhm.
just can you tell me more about it?
Okay.
Yes, doctor.
Okay. Okay. Thank you.
Yes, doctor. So, Dr. Farin, you are ready to do the case?
Yes, doctor.
Okay, doctor. So I'll be giving case, okay? Doctor, whenever you guys are taking the history should be completed. Presenting illness should be completed. But the thing when you're talking about red flags and other things, ask two or three red flags or one or two differential and come out. Don't ask each and everything. Okay, your patient is Mr. Faisal. He's a 45 years old gentleman. Come to discuss his problem with you and his report with you and take proper history and manage the patient. Examination is not required. Patient BMI is 33, West circumference is 108, blood pressure is 148 by 92. Okay, Dr. Farin, start.
Sir, can you repeat BMI and
BMI 33, okay, weight is 95, West circumference is 108, and blood pressure 148 by 92. So this is instruction written outside your station.
okay.
He come to discuss his report, okay?
Okay.
Okay, start.
Good morning, Mr. Faisal. I am Dr. Farheen. How can I help you today?
Doctor, I'm just worried about my reports. They're really scary reports came from for me, doctor. I don't know uh, what's wrong with me, doctor.
Mm-hmm. Mr. Faisal, can I check your reports?
Sure, doctor. Doctor, patient fasting sugar is 6.4, is impaired fasting, and HbA1c is 6. Triglyceride is 265. HDL is only 28. LDL is very high, 235. LFT is raised ALT. EGFR is normal.
Okay. What about blood pressure? It's
Blood pressure 144 by 80, 144 by 148 by 92.
okay. And fasting blood sugars are impaired.
Yes.
Okay. Okay, Mr. Faisal, I just want to ask you more questions. Are you comfortable?
Sure, doctor.
Okay, Mr. Faisal, why did you do this test?
Doctor, 3 years ago, I just got diagnosed with borderline high blood pressure.
Mm-hmm.
Recently, I was feeling tired and feeling headache. I thought maybe I will be doing
Okay.
the test. But doctor, after doing this
Okay.
test, it's really scary to claim that I'm going to die, doctor. That much bad reports I have in front of me.
Okay, Mr. Faisal, don't worry about that. We will discuss in detail about your reports, okay?
Sure,
Mr.
doctor.
Faisal, I just want to ask you more questions. Then I can tell you in detail about your reports. Are you
Sure, doctor.
comfortable?
Sure, doctor.
Okay. So, Mr. Faisal, you did this test because you are in previous reports your labs are impaired. That's why.
Yes, doctor.
Okay. Has any doctor prescribed these tests, or you did by your own self?
No, doctor, there was an offer going on, so I did this test.
Okay. Okay. So, Mr. Faisal, do you have any complaint of like chest pain or shortness of breath?
No, doctor.
Okay. And do you have any complaint of headache?
No, doctor. Yes, I had
Any
headache,
bloody
doctor,
nose?
a couple of days ago.
Okay. And did you take any medicine for it?
Doctor, I took only paracetamol. It settled down, doctor.
Okay. How severe this headache is? Like if I'm asking from 1 to 10.
Doctor, it was just a discomfort only. I thought maybe I didn't sleep well. That's the reason.
Okay. Okay. So do you have any blurring of vision?
No, doctor.
Okay. Any weakness in particular part of body?
No, doctor.
Okay. Have you noticed any frozen urine?
No, doctor.
Okay. And Mr. Faisal, have you recently noticed like passing more urine, going to washroom more
Uh,
often?
no, doctor. Whenever I'm drinking more water, I feel to go.
Mm-hmm. And do you feel more thirsty?
No, doctor.
Okay. And what about your weight? Like, have you noticed any changes in your weight?
No, doctor. My weight is, I'm obese, doctor. I know that it is 33 BMI. So almost 32, 33 my BMI.
Mm-hmm. Okay. And Mr. Faisal, tell me about like, have you noticed any pain in your legs while you walk around and then it will leave on rest?
No, doctor.
Any lumps and bumps, any swellings under your skin?
No, doctor.
Okay. Okay. So, Mr. Faisal, tell me about like, do you have any like, did you take any medicine for high cholesterols as your reports show high cholesterols?
Never, doctor.
Okay. So you are right now you are not on any medication.
Yes, doctor.
Okay. Okay. So Mr. Faisal, do you have any long-standing illness? Yeah, have you ever been diagnosed with high blood pressure, high blood sugars?
Doctor, 3 years ago, doctor told me that my blood pressure is on borderline.
Mm-hmm. And you are not taking for medicine, right?
No, doctor.
Okay. And do you have any cardiac history?
No, doctor.
Any history of a stroke?
No, doctor.
Any history of TIA, like which is called mini stroke?
No, doctor.
Okay. Mr. Faisal, do you have any family history of the cardiac disease?
Doctor, my father had a heart attack when he was 60.
Mm-hmm.
My mother was having blood pressure, and my father had diabetes too.
Okay. So sorry to hear about your father. How he is feeling now?
Doctor, he is doing well with medication, doctor.
Mm-hmm. Okay. So, Mr. Faisal, any tell me about your diet. Like,
Diet, doctor, I'm eating everything.
everything like you prefer to eat home cooked food or like the junk food, maybe.
I'm taking from outside, doctor.
Mm-hmm. And what do you do, Mr. Faisal?
Doctor, I'm a salesperson. Mostly, I'm sitting. I'm driving throughout the area, and if I'm getting time, I'm sitting in front of the and computer all the time.
Mm-hmm. I can understand that your job must be too tough. Mr. Faisal, do you smoke?
Yes, doctor.
How many cigarettes?
15 cigarette daily per.
And have you ever tried to quit it?
No, doctor.
Okay, so Mr. Faisal, how about try to quit it? It's not good for your health.
Doctor, I really want to quit. Is there any way to quit?
Yes, sure. I will book a separate appointment and we will discuss how to quit it, right? And
Okay,
it's really
doctor.
good that you are thinking about quitting, right?
Okay, doctor.
Okay, so
Thank you,
Mr. Faisal,
doctor.
any alcohol intake,
No, doctor.
any recreational drugs,
No, doctor.
and are you married? What about your like things at home?
Doctor, everything is fine. I'm married.
How many children?
One child.
Okay, and how's your relationship with your wife?
Doing good, doctor?
Uh-huh. And Mr. Faisal, tell me that how active you are, like you go for a walk or exercise, anything else.
No, doctor. I don't go for because I'm not getting time.
Mm-hmm. You are busy in your work, right?
Yes, doctor.
Okay. So, Mr. Faisal, uh, what do you think? What these like symptoms, like what thing worries you most apart from that you are worried about your lab report? Anything else?
Doctor, I think I'm overweight and I'm worried that maybe I'll be getting diabetic like my father and I have to stay up end up with insulin. Or maybe I'll be
Mm-hmm.
getting heart attack like my father.
Mm-hmm. I hope not, Mr. Faisal. And what do you expect from me?
Just wanted to know, is it reversible, doctor?
Yes, we will discuss this thing, Mr. Faisal. And how far this thing impact your life?
Doctor, I just feel that guilty about my lifestyle.
Mm-hmm. Right. Okay, so Mr. Faisal, don't worry about that. We will discuss each and everything in detail. Mr. Faisal, as you bring all your reports, and I have checked all your reports, your cholesterol levels are higher, are on the higher side, and your sugars are impaired, and your blood pressure is also on the higher side, and your, BMI is also on the higher side, right? So your blood reports are deranged. Are you getting?
Yes, doctor.
Okay, so first, what you this is called metabolic syndrome. Do you have any idea about this?
No, doctor.
Okay, so basically, metabolic syndrome, it is a group of health problems that happening together, and if it's not controlled, it will increase your risk of stroke and diabetes and heart disease. Okay.
Mm-hmm.
So we have to control it. First, what you have to do, try to, improve your lifestyle. Like you told me that you not get enough time to walk and join on any gym. So what you can do, like take some time out only for the weekends, or if you go for a work, then park your car far away from your, office and go and walk and go for a brisk walk. Okay, can you do it?
Mm-hmm. Yes, doctor.
Okay, and also as your blood sugars are on the higher side, so try to quit it down like sugar intake, and also your improve your diet also, increase intake of the like meat and fruits, sorry, vegetables, and and try to cut down the sugary added sugars and added salt in
Okay,
your
time
diet.
up. So, doctor, Farheen, a good try. I must say that you are patient-centered. That is a good habit. Keep it up. That is important part of your exam. And even though in your real practice, if you are patient-centered, you will be retaining your patients rather than losing the patients in your real practice. Okay.
But
Metabolic.
for pharmacology नहीं बताई.
Sorry, doctor.
I just didn't tell the pharmacological management and
No,
not
doctor, this is
pharmacology.
just beginning of your day, okay? So tomorrow we will be completing our 8 days. So there is some sort of analysis we have prepared for you guys. We will be focusing on that one. But let me tell you, few things you went into depth, which took you a lot of time. It's not wasted time, but took a lot of your time. Okay. So you have to avoid in a way to ask double barrel question. One part that second thing you should not repeat that sentences what patients told already. Okay. Okay, and you
Okay.
should not mention some sort of confirmatory questions. Okay, so confirmatory questions are the negative part. Okay, I do believe that you're married, all kind of stuff, or I do believe that you are not going for the walk. This is just example I'm giving. Okay, you didn't ask this thing, but I'm
Okay.
giving example. So in management, there are three parts out there. Okay, one we are going to explain the metabolic syndrome and the risk. Second is lifestyle and
Mhm.
weight management. Third is medication decision and follow-up. Okay, must be
Okay.
clear and simple. Mr. Khan, from your reports and from your history, I'm suspecting that you are suffering from the problem we call it metabolic syndrome. Do you have an idea about it? Okay, you can say in your own word that it means a combination of risk factors tend to occur together, as you mentioned very well. Large waist size, raised blood pressure, abnormal cholesterol, borderline high sugar. Together, these things make it much more likely to you, much more likely that you developed or you suffering from the problem. You will develop diabetes and heart disease if we do nothing. Here, you're going to give a little bit
Okay.
warning, huh? Now, second thing, we are going to highly specific focus on patients' central obesity. raised blood pressure, high triglyceride and low HDL, and borderline high sugar and high LDL. Okay. So emphasizing on the opportunity, the good news is that many of these we improve with lifestyle changes. Sometimes to the point of reversing the risk, as you've been thinking about, we can also use some medications. We needed to protect your heart and prevent diabetes. Are you getting, Mr. Khan? Now, shall we discuss the management plan, Mr. Khan? Okay. Now, first of all, we will be discussing our management plan. We call it lifestyle and weight management, Mr. Khan. As I'm looking at your BMI, which is higher, so our aim to you reduce your weight 5 to 10% over the 6 to 12 months as a first step. Okay. Even losing 5 to 10 kilo can significantly reduce your blood pressure, improve your sugar and cholesterol, and lower your risk. Are you getting me, Mr. Khan? This you're going to give the plan as 6 to 12 months. Now, talk about diet. General principle, doctor. You can say that we have to increase, as you mentioned, that increase the vegetable salads with the main meals. Whole grain. This is the main thing. In South Asia, you have to talk about the grain. If not talking about the grain, patient will be keep on pinching you. Huh? Whole grain rice, brown rice, wholemeal bread and oats, legumes like say lentils and beans and nuts in a small portion, decrease sugary drink, juices, sweets, pastries, fried food, and large late night meals. Here, doctor, you have to ask about how when you're taking. He was skipping the breakfast, he was taking late night food, and he was taking heavy meals at night time. Okay, simple changes you can make it. Replace your sugary drink with a water or unsweetened drinks. One. Number two, take a healthier packed lunch 2 to 3 times per week instead of fast food. Okay, half the plate of should be vegetable or salad. Quarter lean protein and quarter starch. This is a simple way you can talk about. No need to talk about Mediterranean or so many things. Just you can mention this way also is fine. Limit pastries to once or twice per week rather than taking daily because he was taking a lot of pastries over here. Okay, now physical activity. Shall we discuss about your physical activities, Mr. Khan? As you told that you having mostly the sitting job and are traveling all across. So we will be starting from low progress. We are aiming to as per your busy schedule. I can understand. So is it okay that if you go for 150 minutes per week, is it okay for you? And take the pause and ask him. Then go with a practical suggestion. Could you start with a 15 to 20 minutes brisk walk at least 5 days a week? Is that okay for you? Maybe in the evening and I mean during the lunch break, it's pretty fine, Mr. Khan. Okay, now emphasize that any movement is better than nothing. Build up gradually. Okay, don't say that you start a gym. Patient will say, Doctor, I don't have money for food, then you're talking about gym. That will be illogical, huh? Other lifestyle men if patient is smoker, so I have to tell about smoking, non-smoking cessation and shared decision. Always you have to choose 2 to 3 realistic goals to start this week. Okay, you have to talk. Okay, he will be saying, Doctor, okay, this time I will try for my diet and walk. Is it okay that smoking and other thing we can keep on another day? You can say yes, okay, fine. Okay, one by one. So means like say this is a patient-centered approach. You are taking shared decision approach. Okay, medication and follow-up. At the moment, I was looking and you say that you have been suffering from the high blood pressure since 3 years. So is that okay? Shall we start some medication with lower dose to control your blood pressure because continuous blood pressure will be harming to your heart muscles and brain. Is that okay for you? Then you can discuss about management plan, what you're going to start it. Or if you are not going to start it, you can, patient is not willing, you can say that I will be giving home blood pressure monitoring chart, bring it after 7 days. First day reading will be discarding, and then we'll be taking the average, and after that we will discuss. Is that okay for you? If patient is resisting, okay. Now, um, you can say that, and for further, I will be checking your kidneys or test also. And for the lipid, doctor, starting as a primary prevention, if you think that patient having a strong family history or having metabolic syndrome within dyslipidemia within metabolic syndrome, we need to start as a statin as a primary prevention. Okay, you have to explain the benefit, explain the risk, and examples. You can tell that you have to take at night time, eight high, and moderate to high intensity with a baseline and follow up with the LFTs. Okay, glucose, as I told you that with the diet plan, but if it's very high, then you can start metformin. Some patient we might start metformin when patient having high weight to aim to benefit in a both way. And uh, you can talk about global cardiovascular risk. Okay, we have to explain that because this these risk factors add together. We treat them in all in one combination, not separately. So patient will be talking, doctor, I will be taking the medication for the blood pressure now. After that, I will be thinking about high cholesterol tablet. How does it look like? You say no, Mr. Khan, it is not possible. You have to say that about you have to talk about that in a way that we are going to treat in a combination. Okay, sometimes patient might ask you, doctor, okay, you say that this is the clotting of the blood, is it okay that I will be taking aspirin? Okay, so we can say that aspirin is not routinely used for primary prevention unless there is a high risk factor. Okay, in your case we are not seeing anything. Okay, so monitoring short term, initially we will be checking patients, baseline bloods and everything, and we will be checking his blood pressure and recheck after 4 to 6 after starting the medication, 4 to 6 weeks, and repeating the lipid profile and HbA1c in 3 months. Long term plan, doctor, we can say that if like say I'm getting the time for weight and waist, blood pressure, lipid profile, HbA1c, and medication adherence and side effect and lifestyle goals. Okay. And communication must be, doctors, very classy and should be very smooth. So it will be helping you a lot. So, doctors, we have
Sir,
covered the three.
sir,
Yes, doctor,
uh,
please go ahead.
can we start AC inhibitor directly, or we have to first offer mobility monitoring as the blood pressure is not on
Doctor,
that?
in metabolic syndrome, metabolic syndrome, what I am getting that we have to start both because metabolic syndrome we are not going to start in a combination. Okay, but sometime my patient might resist. So I given you the example. Patient is been
Okay.
diagnosed with a high borderline high blood pressure since 3 years, and he's not a regular to the doctors.
Okay.
Yes, doctor.
And sir, before prescribing statins, so first we have to calculate the Q risk free, no?
Yes, doctor.
Or we can start it directly.
No, you can verbalize that. I will be checking your cardiovascular score, and after that we will be starting that one based on your score. This thing that at least that specialist should know that what you're going to talk about.
Okay. Okay,
Okay.
thank you, sir.
So yes, doctor. So doctor, tomorrow we'll be discussing obesity with raised blood pressure and a few mixed scenarios will be there, and then we will be completing our cardiovascular. Okay. Today I'll be taking break because I have to go for my duty. And inshallah, see you guys tomorrow, same time. This week, doctor, I'll be taking all the sessions in afternoon, and next week we will be making it afternoon and evening mixed. Okay.
Okay,
Thank
sir.
you, doctors. Thank you, Lord.
Thank you.